Hi, I'm Dr. Tanya here with Tuesday's tips to keep your family healthy and safe. Now that we've all been home for a few months, which has really made a difference in decreasing the numbers of patients with COVID-19. So thank you all for staying home and being safe. But now that it's warming up and different areas around the country are opening and kids are getting stir crazy, I have more and more parents coming to ask me, what are some safer ways that we can let our kids play with friends, be outside, and really enjoy this summer? So today we're going to talk about how to safely play. If you haven't already subscribed to my channel, please do. Again, this is Dr. Tanya Altman with Tuesday's tips to keep your family healthy and safe. So today we are talking about how to safely play in the era of COVID-19. So my first tip is outdoors. Anything that you do outdoors is safer than indoors because being outdoors dramatically decreases the risk of transmission of the virus. Dilution is the solution. So when you're outdoors, the virus gets diluted as you breathe and talk into the air. So if you can have play dates outdoors, if you can visit with relatives outdoors, that would be a much safer way than being inside. The second is to wash your hands. And we know that as kids go back to activities in school, if they simply wash their hands every hour or two, that will reduce the risk of transmission of not only COVID-19, but other illnesses as we get into cold and flu season. So you want to have your family wash their hands before they visit or play with others, wash their hands every hour and a half, after they use the restroom, before they eat, and again when they come home. And if soap and water aren't available, you can use an alcohol-based hand sanitizer. And don't forget that both soap and water and sanitizer should be rubbed on your hands for 20 seconds. Number 3, masks. Okay, now I know that there's a great mask debate when it comes to younger kids. We know that up to 50% of cases of COVID-19 are spread from people who have no symptoms. So they either are asymptomatic or they are pre-symptomatic, which means it's a few days before they're going to get symptoms and they are spreading their germs. So simply by wearing masks has dramatically decreased the transmission in our communities, which is why it's important to wear masks when you go to the grocery store, when you're going for a walk and you can't stay 6 feet away from other people. But when it comes to young children, this isn't always feasible. So we know that kids under age 2 should not wear masks as it can be a suffocation hazard. But the recommendation is for kids over age 2 to wear masks. Now, saying that, I know that not all young children will be able to wear masks. And I think that age 8 and above, your kids should wear masks whenever possible when they're around others. But you have that kind of gray area from age 3 to 8. And I would say try your best. I have many 3 and 4-year-olds who come into my office wearing masks. They want to be like mom and dad. They don't touch their face. They don't have any problems with it. But my own 5-year-old, I'm trying to teach him how to wear a mask before he goes to camp in a few weeks, and I have not had any luck. So we are playing games with masks, we're putting him on stuffed animals, and I'm trying my best, but he keeps saying, Mommy, I don't want to wear a mask. I'm just going to stay 6 feet away from my friends, as you said on the news. And although it's super cute, I'm trying to work with him. So simply do your best. And if you have a child with developmental issues, with medical issues, where they just can't wear a mask, that is totally fine. Don't fight with them. As a pediatrician, we understand that wearing masks are not feasible for all children. That said, if they're not wearing a mask, they may need to stay a little further away from their friends. Number 4, choose safer friends. So what this means is that you should try to choose friends and family to play with who you feel are being safe and are at low risk for having COVID-19. So families that you know that have been mainly staying home would be a good idea, as opposed to going to the park and just playing with random people that you don't know and you don't know where they've been and everybody's touching the same things. So you can try to screen out your friends, you can talk to them, and you can decide, hey, we are all sort of low risk. Why don't we just play with each other for the next few weeks outside in our backyards and really try to be honest with each other if we feel that we might have been exposed to anyone who has COVID-19. That way we can try to best keep our families safe. Number 5, keep a few feet away. So whenever possible, you want to have your kids a few feet away from each other and wearing masks if possible, and again, outdoors. So what this means, if his kids are gathering, maybe have them outside. Even my 5-year-old knows not to get too close to his friends or even to grandparents. A grandparent came over this weekend and put out her arms to hug him, and he stopped about 6 feet from her and looked at me, and I said, "It's okay. You can hug her around the middle, just turn your face to the side, and be quick." And she was so thrilled that, I let him hug her. So anything that you can do at a distance is safer than being right in somebody else's face. So that means you can set up little play areas maybe around your backyard. They can kick a ball back and forth at a distance. They can run around and play tag, but they can avoid being super close, wrestling, and touching all the same items that their friends are touching, just in case. The next thing is to stay home if your child is sick, if anyone in your family is sick, or if you feel that you or your children have been exposed to anyone who has a fever, who may have other symptoms of COVID-19, or who has tested positive for COVID-19. And this is something that's really important to talk to people about. And don't be embarrassed. This is going to happen when kids go back to school. We're going to have to tell the school, you know what? Our family may have been in contact with someone who was sick, so we're going to keep our child home for a week and get us all tested just to make sure we don't infect anyone else at school. Or, my child had a little fever, so we're going to stay home for a few days, see how this plays out, and follow the school's rules for when kids can return to school after being sick. Because it's really important. We know that this virus is very contagious, and we don't want to accidentally expose anyone who might get seriously sick or might live with someone who is more medically fragile or older, who has the potential to get seriously ill from COVID-19. Another tip is to swim or play in the water. It's very hot right now going into the summer, at least where we live in Southern California. So water activities are a great idea. We know that the virus cannot be transmitted through water. So you could have another family over to maybe swim in your pool and stay on opposite ends of the pool. You could turn on the sprinklers and let kids one at a time run through the sprinklers and take turns so they're not getting really close to each other, but they're all having fun and cooling off in the hot summer sun, because these are important memories and activities that our kids like to do during the summer. And who doesn't want to cool off on these 100-degree days that we're having now? So run around and kick the ball. I mentioned this before, but yes, any activities where kids can be a distance away and not share the same objects. So kicking a ball back and forth across a field, playing soccer without being in close contact would be a lot safer than playing football where you're throwing the ball and tackling your friends. Other ideas could be, running around in circles, playing tag where you pull the flag off of the child's back instead of their front. That way you're not getting right in their face. But there's so many fun activities kids can do with their friends outside. Blowing bubbles. I know my 5-year-old loves blowing bubbles in the backyard. And so as we were blowing bubbles the other day, I started thinking, how can kids safely blow bubbles when they're playing with each other? Well, you want to make sure they're not blowing on each other. So maybe they could turn opposite directions, not facing each other, and blow bubbles. Maybe you can have an adult blow bubbles for all the kids standing 6 feet away. Or you could buy a bubble machine so nobody actually has to blow the bubbles themselves, and the machine can just blow the bubbles in the air, and the kids can run around and pop the bubbles and have fun without having anyone directly blow or breathe on them. Number 10 is don't share supplies. So for instance, we had a chalk party on our driveway, and I had stations set up 10 feet apart with chalk. So each child could draw in their own area, but they weren't sharing chalk and getting too close to each other. This could also work with painting stations, with canvases set up in your backyard, arts and crafts. Kids could be at separate ends of a 6-foot-long table. So there's a lot of things that you can do where you can just get duplicates so kids don't have to share supplies, or they could take turns being at different stations with different activities where parents can actually wipe down and disinfect the supplies before kids switch stations. Pack lunch, snacks, and water whenever you can, and ask your kids not to share food with friends, as this is just another way to help decrease transmission of the virus, because we know that when kids are reaching into common snack jars or bags or boxes or containers, that's a way that they can transmit infection. So if everybody just packs their own and brings it and sits a few feet apart or 6 feet apart ideally while they're eating lunch and snack and drinking water, that would really help decrease the risk of catching COVID-19. In addition, when your kids are wearing a mask, when they're running around outside, don't forget to give them plenty of water breaks, as it's important to stay hydrated when you're outside in the sun. And sunscreen and hats are a great idea as well. Number 12, consider getting COVID tested. So a lot of families are asking me, should we get tested before we visit relatives, before we have friends come over, or before we travel to somebody's house this summer? So let's talk a little bit about COVID-19 testing, what that means, and when may be a good time for you to get tested. So the best way to diagnose, do I have or does my child have COVID-19, is with a nasal swab that's sent to the lab for a PCR test to say, yes, the COVID-19 virus was detected. There are also some cheek swab tests, saliva tests available, but most are still nasal swab tests right now, and they all take several hours to a few days at a lab that your doctor or an urgent care or public health can send the test to. Now, over the next few months, I do anticipate seeing more point of care tests available, so I even hope to have some faster tests in my office, and your doctor may as well. So if you feel like you've been exposed to somebody who may have COVID-19, if you've gotten off an airplane, if you have somebody coming to stay at your house who's traveled, the ideal time to test them would be 5 days after that potential exposure. So what I would recommend relatives traveling in to visit you, if they can quarantine, stay somewhere else for 5 days, and then you test them all. If they're all negative, then they can visit your family, see your new baby, or be in your house. The majority of the time, actually over 95% of the time, a virus should be detected in the nose 5 days after exposure. So that helps decrease that 14-day quarantine that you used to hear about, when people are flying or traveling or potentially been exposed. This is also going to help get our kids back to school this fall, because if we can test kids the week before school and say, okay, you're all negative, we know your baseline, we know you're starting out, you can go to school, that's fine. And anyone who's positive will need to quarantine at home for 14 days until we can say, okay, you are for sure no longer contagious. Or if you have symptoms, it can actually be 7 days, depending on when your symptoms end, and you can go to the CDC website to see all the recommendations for when someone who's tested positive for COVID-19 can then be around others. But if we know that first test, that'll really help, because when your child gets a fever in September or October, the school is likely going to say, you cannot return to school unless your child has a negative COVID-19 test. And what if they had COVID-19 a month or two ago? Some people still test positive. So it's kind of a good idea to know this is a new infection and not an old infection from the summer. So if you do have the ability to get a baseline test before going back to school, that's something that many schools are recommending. I also have families saying, you know what, we are going to be playing with each other. Could you test all of us? And then we're all going to be really careful and stay quarantined and kind of form the same social bubble so our kids can play together this summer. And again, that's a personal decision, something that you can decide on with your family. It's all about lowering the risk. So, I would say you can't do everything that you want this summer, but you can sort of pick and choose what would be the lowest risk for your family to still allow you to get out a little bit, to have some fun, and to get your kids some happy summer memories. And so my last tip for everybody is to have fun and do your best. This won't be the same summer that we had all thought about all school year and planned for, but there are still so many ways to have fun this summer and safely play with your friends. If you have any questions or topics you'd like me to cover next week, please leave them below. If you haven't subscribed, please do. And until next week, stay healthy and safe.